Here I'm doing a pre-examination on Coco before she goes under anaesthesia today. So her heart rate read at 120 beats per minute, respiratory rate was 27 breaths per minute, capillary refill time 1 second, mucous membrane was nice and pink, teeth, eyes, ears, nose all good, no discharge or smell. She had no bumps on her body. Her coat is good, it's nice and shiny. I'll give her an ASA class of 1, but her temperature did read at 37.7, which is pretty low, so I just put some heated packs under the towel for her so that she can warm up a little bit, and her pulse was good and strong. I'm checking we have enough Betamox, enough Loxicom, enough Atracite and enough ACE for Coco for her surgery. So now I'm just giving Coco her pre-med, 0.3 mils of Atracite and 0.3 mils of ACE. The vet directed me to give this amount to her, and I needed an assistance from one of our other nurses there to hold her still for me while I give the injection. I gave the injection in the scruff of her neck. I'm now setting up surgery for Coco, so I'm going to connect the breathing tubes to the anaesthetic machine, and then I'll change the breathing bag to the correct size for her. We chose a 2-litre breathing bag. I'm now going to select the ET tubes. I chose 6.5, 7, 7.5. The accessories for that we use is a shoelace and a syringe. The syringe to blow up the cuff, and the shoelace to tie the ET tube in once she's intubated. I'm then going to grab the equipment which we'll need, which is a dog spay kit, medium drape with a medium hole, and a thoracic positioner to keep her in the correct position throughout surgery. I am then going to collect a size 20 scalpel blade for the vet and sterile gloves. I am now going to check that we have enough oxygen in the oxygen tank, and checking the monitoring equipment to make sure they're all working properly. And I selected a rebreathing circuit for her today, considering she is over 10 kilos. I am now getting the tattooing equipment, which we'll need considering she is getting desexed today. I'm now selecting the catheter equipment. Chose an 18 gauge catheter. We'll use soft band, vet wrap and tape to secure it. And the heat source is the towel on the surgical table. And I'm testing the surgery lights, making sure they're working properly. We are starting surgery on Coco. We have taken her into the surgery room, holding her in sternal recumbency position while the vet intubates her. I quickly brought a cuff up on the ET tube, and now we will put her onto the thoracic positioner to hold her in place. We also use sandbags, and I've clipped her abdomen where we will be doing the surgery. I cleaned it with claw hex and iodine in a circular motion in and out. I'll then get the equipment for the vet. I am unable to check the temperature throughout the surgery as it is in the surgical sterile field, but I'm checking her heart rate, respiratory rate, mucous membrane, reflexes, jaw tone, all that, well, every 5 minutes to make sure she's going okay. And before she wakes up, I will give her injection of Betamox and meloxicam for pain relief and antibiotics. She was not pregnant, which was always good. She was just in season. Now that the surgery is complete, we'll just keep her on oxygen, turn off the ISO, and I'll clean her with Chlorhex, moving away from the incision line. I'll keep checking her vital signs until she is awake. I'm now able to get her temperature as the surgery is over. Once I extubate her, I will then move her to her cage and then continue to monitor her vital signs until she is awake and all of it is back to normal. She did wake up pretty quick. While she was in surgery, she was in dorsal recumbency position.